Okay, gonorrhea by Tanisha Delvaye for microbiology. Okay, the pathogen gonorrhea is a sexually transmitted disease that has been around since ancient times. It is caused by a bacteria and is known as a discharge disease because it's sexually transmitted and can be spread in a multitude of ways, but mainly through sexual contact with genitals and bodily fluids of an infected person. The life cycle tends to occur in four different stages: attachment, penetration, proliferation, and the inflammatory response. In the attachment phase, the bacteria of gonorrhea uses pili to attach to the mucosal cell surface. It then penetrates locally, and then the bacteria replicates, and the body then has a local inflammatory response. So, Neisseria gonorrhoeae is a pyogenic of pus forming gram-negative diplococcus and appears as a kidney or coffee bean shaped bacteria, and their flat sides touch. So, as you can see the neutrophils and the gonococci. The neutrophils trying to attack. Transmission. A person can first become infected by having anal or vaginal or oral sex without a condom with an already infected person. It is caused by bacteria and is known as a discharge disease because it's sexually transmitted. The disease tends to occur in four different ways. In the It then attaches the bacteria may survive outside the body for up to 24 hours in wet secretions and may be transmitted for up to 3 hours, but when dried, the bacteria does not survive outside the body for long periods of time. To limit transmission and prevent this, precautions like using condoms is ideal and the most important line of defense from sexually transmitted diseases. In males, infection of the urethra causes urethritis, white, green, or yellow discharge from genital area, and painful urination. This infection is most likely to stay in the distal urogenital tract, but may spread to the prostate gland, which can cause scar tissue in the spermatic ducts, which can cause a man to become infertile. In females, it is more likely that the urinary and genital tracts will become infected, resulting in mucus, pus, or bloody vaginal discharge, and discomfort or pain during urination. A cyst may also form if a duct becomes obstructed and infected, and it is commonly known as a Bartholin's abscess. Females may also suffer from more serious complications if the infection goes without treatment and ascends toward the uterus and the fallopian tubes. Like in men, buildup of scar tissue in the fallopian tubes can cause sterility and ectopic pregnancies, which are fatal to the fetus and sometimes the mother. Gonorrhea can also affect other parts of the body other than the reproductive tract. The bacteria may enter the bloodstream and penetrate into the joints and skin, leading to chronic arthritis and painful sporadic popular rash on the limbs. It may also increase your chances of getting or receiving HIV because of weakened immune systems. According to the Centers for Disease Control and Prevention's surveillance report in 2018, there were 583,405 recorded cases of gonorrhea in the US with a morbidity rate of 171.1 per 100,000 people. And then this is the Bartholin's with the discharge. And this is the pus that comes out. So, diagnosis and treatment. Best way for diseases to be diagnosed is a urine test to identify bacteria in the urethra or a swab of the affected area, throat, vagina, urethra, rectum, and it is sent to a lab to be identified. To treat gonorrhea, the most common first line of defense is antibiotics. Unfortunately, there have been many drug new resistant and gonorrhea from that the uncomplicated strains are treated with cetrafaxone, which is given as an injection. The disease may still be spread while on treatment for up to 7 days, and therefore testing is recommended again after 3 months. It is cured with a course of antibiotics. Demographics: anybody that is sexually active is likely to get gonorrhea, especially young adults and those who have unprotected sex. Teenage girls and young women are especially susceptible because their cervixes aren't fully developed and cannot fully defend them from the disease process. Sex workers and men who have sex with men are also increasingly susceptible because of increased probability of anal sex and multiple interchanging partners. The USA was second in prevalence of gonorrhea among men. The prevalence was highest in the African region, 1.6%, and the Americas, 0.8%. Western Pacific, 0.7, and lowest in Europe, 0.9%. And these are my references.